Hello, and welcome to the virtual Mental Health Year in Review. I'm Dr. Jennifer Klemp from the University of Kansas Medical Center.
And I'm Dr. Eva Ritvo, a psychiatrist from Miami Beach and the author of Be Kinder, The Transformative Power of Kindness.
We are excited today to share some thoughts and some discussion with you. And throughout this conference, we'd like you to be chatting, putting in some questions in the chat box related to issues surrounding mental health. Our objectives for today will be to quickly review sort of the common elements of burnout and compassion fatigue, and what are those warning signs we should be looking at, not only in our professional life, but also in our personal life. We're going to look at how we can sharpen our tools and really improve the techniques and skills that we have at combating fatigue, as well as a lot of the aspects of burnout, and then some self-care strategies and ways to build our resources. So as we jump in today, I think it's really important to sort of right size how we think about compassion fatigue, and burnout. And most of us who work in healthcare are drawn to this field, to our scope of practice, because we are empathetic, because we are natural healers, are born to really fill that role and to exude compassion. But we know that compassion obviously has some kind of thresholds to it. And when we're caring for those who are suffering, we feel empathetic and we want to act and advocate on behalf of our patients and their caregivers. But at some point, that can also sort of teeter over into what's called compassion fatigue. And that's where we can start to feel sort of exhausted. We have biologic and physiologic and psychosocial and sort of all sorts of kind of side effects that can happen from our ability to be empathic, but also hitting kind of these thresholds where we're tipping over and we're feeling a little stressed. And then the ultimate of the spectrum is what was called burnout. And that's where we've gone from the compassion fatigue state to really feeling emotionally exhausted. We're cynical. We're just, we're not feeling that joy and happiness that we once felt, not only for the patients that we care for, but also that can translate out into our personal life. So as you can see, this is sort of on a continuum, and the continuum can kind of go back and forth, but really important to know that these are sort of different steps and that we can reverse those or address those along the way. The other important factor about burnout is that it is unfortunately very common. It is on the rise. And as we think about this mental health review over 2020, we've had a lot of things happening. We have a pandemic with COVID. We have stress from elections. We have stress from our finances. We have lots of different stressors that are really all coming together. And that's adding an additional layer to what we're trying to do in our work, our home, and really the bigger picture of us as a whole person. So when we think about this becomes sort of a complex syndrome of emotional distress. Healthcare workers are disproportionately affected by burnout. And as we said, a lot of these external factors are really impacting our ability to deal with burnout and compassion fatigue. The worst part of that is the cost, and cost has a variety of definitions. There's financial cost, there's emotional cost, there's cost to our relationships, to our job satisfaction. So when we really start to inventory all those aspects that go into cost, it definitely has a huge negative impact, and is something that not only needs to be addressed as soon as possible, but we need to figure out how to incorporate that in as part of the norm, not something that we react to once we've sort of hit the end of that continuum. This, I thought, was a really nice article, and it's a great reference. Unfortunately, kind of talking about this increase. So not only are we seeing, a doubling or tripling of some of the negative consequences of compassion fatigue and burnout, depression, we're seeing huge increases in suicide and other very dire and unfortunate consequences of not being able to have an environment that can support each other and really help identify and nurture those needs along the way. We also know that female healthcare workers tend to have a disproportionate level of distress and burnout. And part of that is because of some of the competing factors that they have, not only at work, but at home. So as we think about burnout being on the rise, as we think about these negative health and financial and a variety of consequences, there are some risk factors that we can look at that really help us identify who's at highest risk and how do we start addressing those risk factors. The first is long hours. And I know if any of you watched the news lately, we're hearing about workforce shortages, not only because of the workforce being compromised with COVID, but also just due to the enormous stressors of managing home and work. We know that leads to that increased workload, both administrative and patient care. We also know that the PPE and other factors leading to us caring for patients in person have really put an enormous amount of stress on day-to-day, both physical and emotional. We also know that because of all these changes, we sometimes feel a decrease in autonomy, and there's this level of oversight because not only of the pandemic, but we also have a changing culture in healthcare to begin with. We have rules, regulations, compliance, we have quality improvement, we have all these factors that really are layering on, and now throw a pandemic on top of that. So what does that result in? It results in us having less time for the things that make us happy, for the well-rounded person and the pleasurable activities. And so this ongoing stress and this ongoing chronic condition is not good for us. It leads to depression, anxiety, other psychosocial issues, as well as really that inequality in healthcare, where we're not able to not only maximize our scope of practice, but we're really not giving the best care to our patients because we aren't our best selves. So it's really this kind of circular experience that is negative and is impacting ourselves, our patient care, and the bigger picture in healthcare delivery. So as we think about this teeter-totter of compassion, fatigue, and burnout, I think that the components that we need to focus on would be in the compassion fatigue bucket, and hope that we don't teeter into that burnout bucket, where we're experiencing the need for unhealthy behaviors, which we will talk a little bit more about. We have that hyperarousal. And I think we really notice that when we come home and we sometimes take things out on those who are closest to us because we've had a really stressful day. And sometimes, obviously, the people at home don't understand all the stressors that we've been through in the past, day or week or months. I think that we then tend to avoid other stressful situations. We withdraw. We seem to sometimes also re-experience or relive some of those stressful situations. So that sort of PTSD effect. We're forgetful, we're indecisive, and motivation goes down, which when motivation goes down, that means a lot of those healthy or happy behaviors that we would normally participate in, they decrease, but so do other things that are important for day to day. So as you can see, when we start thinking about that bucket of risk factors, we really need to chip away and start practicing and learning skills to help prevent some of these unfortunate and unwanted effects of compassion fatigue. Once it falls into burnout, then we've really hit sort of that quick fuse. We're impatient, we have cloudy judgment, we're very cynical. And at that point, we've hit a much harder and much deeper place that's harder to get out of and requires a lot more support. So I think that, when we think about our organizations and our friends and our families and our colleagues, we're all sort of aware acutely that these are issues, but it's really hard to get that type of support, to want to come home or take that much additional energy to talk with someone about our stressors when we're already feeling very maxed out. So as we think about this teeter-totter, as we are aware that these are very common right now. These are not something that makes us an outlier. We're unfortunately really part of the mainstream right now. We need to be able to build our tools so that we can help prevent and work towards a healthier and more well-rounded lifestyle. I think this is funny because wouldn't it be great if we could just find this magic pill that would take it all away, and we would just be able to deal with all these compounded stressors. But this is not real, of course, but looks real, but plays on, wouldn't it be great if there was just that magic pill and the magic pill for weight loss and everything else that we would like. So overall, I think it's important for us to reflect and really identify that compassion fatigue and burnout are real. They're very common right now. We know our organizations are trying to help us with this, but we have to be part of that as well, supporting ourselves, supporting each other, and identifying those risk factors and encouraging those around us and our workplaces to really help us build the support and the resources that we need. And as we take the next steps into learning about these tools, I think that we start with self-care and we really start thinking about how we build a little bit of work-life balance, sort of one moment, one step, one day at a time. This isn't something that can happen overnight, but it's definitely something that we need to start taking those steps in that direction.
Thank you, Jennifer. That was a very beautiful and meaningful presentation. And we're all suffering a lot right now. And I think it's really important to acknowledge that and to acknowledge that we're here at this conference and hopefully we can leave making some changes. So I started my first slide with physician heal thyself, because this is a recommendation that goes all the way back to the Bible. But I think it's particularly relevant now. I think COVID has created an unbelievable level of stress that as healthcare providers we're really not used to, and things were quite stressful before COVID. So I think this is a moment historically for healthcare providers to take healing thyself very, very seriously. In fact, you can see that I'm at the beach right now, and that's because I'm a psychiatrist, as you heard, and I'm teleworking. And as a psychiatrist, it's a very unusual experience to have all your patients in a very similar crisis to the one you find yourself in. And at the beginning, I just found it absolutely overwhelming to work, and my mental health wasn't there to be providing mental health for my patients. So I've had to work really hard during this pandemic to get myself feeling well enough so that I could then take on the stress of people, particularly when they're suffering from a very similar stress. So this is my escape for the election, because I didn't want to layer the COVID stress and the election stress. So I'm at the beach. So as you mentioned already, there are many different ways to approach self-care. But the most important thing that I want people to take home today is we are important. As healthcare providers, we are not at the end of this pandemic. We don't even really know if we're at the middle of it. So it's imperative that we take care of ourselves. And that has to be done first. We've all heard the analogy of when you get on the airplane, if the oxygen decreases, put the mask on yourself, and then you're able to care for others around you. When this crisis first broke in March, no one was able to do that. We were so heavily into this trauma. We just rushed in to try to do whatever we could. But now this is a more slowly evolving trauma. And it's really important that we take care of ourselves, because this is a marathon, not a sprint. So make sure that you are taking care of yourself. And in our brief time together today, I'm going to give you some tips and tools. And what I'm going to say to you today is not new. I promise I'm not going to say one thing to you that you don't already know. But what I am going to do is hopefully give you permission and some guidance to take care of yourself. Because as healthcare providers, unfortunately, sometimes we're trained in the reverse. And I often think back to my 20s, now that I have daughters in my 20s, and I see what their life is like, and they're sort of that defining decade. And I recall my defining decade, being in the hospital, you couldn't sleep. Food was pizza, And sometimes you weren't allowed to go to the bathroom. On really bad days, you weren't allowed to go to the bathroom. So when you hear that message for a decade from 20 to 30, you really ingrain in your head that you're not important and that caring for yourself is not important. And so for me, this pandemic has been an opportunity to really right a lot of wrongs and to try to learn to take care of myself, because truly for decades, I have not taken the best care of myself, and it's a whole new world. So I hope that listeners today will take on the message that they are valuable. Yes, they should be taking care of patients, but first they should be taking care of themselves. And we need to filter through things through a different lens. I have one friend who's a psychologist who's been very helpful to me through this trauma. And every message she ends with, stay well. And it's so nice to have that constant reminder that we are facing a potentially deadly disease and that we have to be responsible to keep ourselves well. So again, everybody out there, please keep yourself well. Filter things through that lens. No longer do we need to filter through, well, I've got to be here, I've got to do this, I've got to do that, I've got to look a particular way. We're down to the basics, which is how can I stay well? How can I take care of myself? The crisis that we're in right now has us in a sympathetic overdrive, and you're healthcare professionals, so I don't have to spend a lot of time explaining to you what that is. We all know what it is. We're living in it. And again, when we layered the election on, our adrenaline's just through the roof. Hence my therapy. So what we do need to focus on as healthcare providers is how do we rebalance our nervous system? And the way we do that is by stimulating our parasympathetic nervous system. And that is nicknamed rest and digest, or tend and befriend. And those nicknames give us clues to what we need to do now to counteract this cortisol and adrenaline of a COVID crisis, of an election, of, as Jennifer mentioned, extra household pressures, kids at home, financial burdens. The list is long. So it's our responsibility to activate our parasympathetic nervous system. Next slide. And keeping ourselves well through boosting our immune system. So COVID-19 has really perplexed us. But one thing that is clear is that we need our best immune status to fight it, because we're all going to be exposed, not just healthcare providers, but at the rate we're going, everybody in our society is going to get exposed. And we've seen quite variable responses. We have people who don't get sick at all, and we have people who succumb to this virus. So for each of us, trying to stay well involves multiple things. It involves sleeping better. And this can be particularly difficult to do during a pandemic. And there's lots of ways to sleep better. But if your sleep is not good, check with your healthcare professional, because as Jennifer mentioned, we can quickly pass from compassion fatigue to burnout. And one of the easiest ways to get there is to not sleep. So there's multiple steps to improving your sleep, but if you can't do them in a simple fashion, that's a really good one to get help on. Nutrition is an interesting thing, because obviously we all know a lot about nutrition, but yet how many of us implement it? As I mentioned, pizza-aholic during medical school. So this is the first time for me that I've really been home enough around a kitchen that I can actually get those strawberries and wash them, have the grapes available, and to really try to eat properly. So I think it's a wonderful time, and many people have taken advantage of it already. But if you haven't, I would really urge you to dive a little deeper into what's in your refrigerator and how can you boost your immune system going forward. And snacking is a wonderful thing. So if you are teleworking instead of working in the hospital, it's a great time to switch your eating habits and to do more snacking instead of less large meals. Supplements. This is something that I believed in for many decades, but I think right now supplements have really come into the mainstream, and everybody has their home remedy, whether it's the vitamin D, the zinc, the vitamin C, the echinacea, whatever appeals to you. Again, you guys are healthcare professionals, so dig into the literature, see what makes sense to yourself, but really trying to boost your immune system as best you can with all the tools we have. And exercise. This is one area which I think we're all greatly suffering from. I always talk in my kindness lectures about mirror neurons, how we have neurons in the brain that mirror what we see other people do. So for example, if Jennifer flashes a big smile, it's going to be easier for me to smile because my mirror neurons for smile are going to get triggered. Well, mirror neurons are a very powerful thing when we exercise, and it goes a long way to explain why yoga at home is so hard to get motivated for, yet yoga in a class is fun and it's easy to follow into a rhythm. So what I'm seeing right now is people are aging at a very accelerated pace due to this lack of exercise. So everybody who's listening today, again, I told you I wasn't going to tell you anything, it's rocket science, but I am going to urge you to do what we all need to do, and we know it already. And exercise is huge. So make sure you're getting outside, if you can, taking a walk, boosting your vitamin D that way. And if you haven't found an exercise you can do safely at home, now is absolutely the time to do it, particularly as we go into winter and it's harder to get outside. People are loving the Peloton, exercise bicycles, yoga is available. So easy to access everything over Zoom. Hard to do without mirror neurons, but it's essential if we want to continue going through this in our best way. Other stressors that we're facing right now is we have just completely obliterated the separation between home and work. In fact, you can see me here with no separation between home and, or between vacation and work. So teleworking has really put us in the deep end of that pool. And this is very damaging to our mental health because we do need to have time away from work. And so it's vitally important, even though you've got your laptop with you and you've got your cell phone with you, to try to set some boundaries. We cannot be working 24/7. We can't be thinking about work 24/7. So take time off, whether it's, evenings after X amount of time, whether it's weekends, whatever it is. We need to create those healthy boundaries. We should not be sleeping with our cell phones. We should not be waking up to our cell phones. Again, not rocket science, but how many of you are actually doing this? And it's vitally important right now to separate yourself from technology, because technology has become work, work, work for most of us. Media detox is another excellent way to decrease your sympathetic overdrive. Again, particularly this week as we're facing these nonstop election returns, just turn it off. Nothing's going to happen in the 20 minutes or hour or 24 hours that you get away from the media. But what will happen is you can dampen down that sympathetic overdrive that you're in and then start to boost your parasympathetic response. Next slide. So one powerful way to increase our parasympathetic nervous system is to get calm. As we said before, to rest and digest, to tend and befriend. Jennifer, thank you for this adorable slide. I'm looking at it and I'm secreting oxytocin as I look at that. That's a beautiful slide. When we see things like this, we just want to say, oh. It's kind of the opposite of when we go into the hospital and we're in all of our space gear and we have all these patients sick and they don't have a family to take care of them. That puts us in overdrive. This puts us back into our parasympathetic. So we have to take responsibility for altering our nervous system. So when I get really upset, my daughters know, send mom some pictures of adorable puppies and she'll feel better in a few minutes. Or conversely, you can take a warm shower or bath because that stimulates that feeling of being hugged. Right now, we're missing out on so many hugs, and that's so bad for us. We need touch to feel good. It releases oxytocin. It calms us down. It makes us feel better. So you can hug yourself by having a shower or a bath. You can actually massage yourself, or you can hug a person if you know they don't have COVID. Also, you can use a weighted blanket. These blankets are readily available. They weigh starting around 15 pounds, and studies have shown they're excellent at helping us release different neurotransmitters and improving the quality of our sleep. So again, it's trying to be an active participant and where you want your nervous system to be. Next slide. You can also connect with nature. I had the privilege of studying evolutionary psychology as an undergraduate at Harvard. And so I oftentimes try to filter things through the lens of what were we designed to do? If we were designed to do it, it's probably going to feel good. So think about our hunter-gatherer ancestors. They were outside in nature all the time. This feels so good. It's so calming, and it brings us into the present moment Right now, there's a beautiful breeze. And anytime we're in the present moment, if things are good, then we're not in the sympathetic overdrive state. We're coming into the present moment where we can get calm, we can connect with nature. Studies have now shown if you can't connect with nature, if you're in a cold climate, if you put something in front of you that's green, even that can lower your blood pressure. So if you're going to be using a treadmill, make sure you put it with a beautiful picture of nature in front of it, and you could trick your brain to think that you're out into nature, and that will help you feel better. Other tools that we all have available at all times are meditation and breathing. These are ancient forms of healing that we've really gotten away from in our high-tech society, that the pandemic is giving us an opportunity to go back to, because we're at home and we don't have a lot of activities at our fingertips. So we need to create activities for ourselves. So creating time to meditate can be very helpful. You can download apps like Headspace or Calm. They'll walk you through how to meditate. You can do as short as 5 minutes a day. But if you repeat this, it can be a very powerful tool for when you get upset, knowing that you have that at your fingertips and that you can take a few minutes to meditate, bring back your nervous system into a better balance, and problem solve much better. When we're in sympathetic overdrive, our nervous system has fight, flight, and freeze at our fingertips for solutions. Rarely are those the right ones in the hospital or with our family and friends. So we need to get our calm part of our nervous system activated so we can tap into our frontal lobe and solve these complex situations from that space. Wonderful new book out by James Nestor that's called Breathe. And he talks again about the ancient technique of breathing and postulates that we are all over breathers and that we need to learn to slow our breath down. He recommends 5.5 seconds for the inhale, 5.5 seconds for the exhale, making sure that we have a very deep exhale, breathing out the toxins. And this can be akin to meditation. You can do it during yoga. You can do it when you're walking. You can do it when you're talking, anytime. But becoming aware of your breath, making sure that you're taking long and deep enough breaths. And we know that when we exhale, we are stimulating our parasympathetic nervous system. We're helping ourselves get calm. So again, not rocket science. But if just a few of you listeners could practice that breathing, we would go a long way towards decreasing the collective stress that we're all feeling. Highly recommend his book. Also vitally important is eliminating toxins, because we're trying in this COVID crisis to obtain our optimal health, to be able to fight this virus when we get exposed. So what I saw in my patient practice, I thought was really encouraging, which is so many people stopped drinking because it was just part of their routine. It was part of their social existence, peer pressure, etc. And when people came home and sort of got into their own biorhythms, they stopped the alcohol. Alcohol does not work very well to decrease your arousal because it's a very short acting medication, and you have a drink and an hour later you want another drink. So it's never a good solution to helping you get calm. So try to use these more ingrained ancient forms like breathing and meditation. Don't go to things like alcohol, pills, marijuana to get yourself calm, because it just doesn't work. And then it creates a whole host of other problems. Listeners, if you need help in this space, help is available. Tap online to the many resources, talk to your healthcare provider, but it's a very important time for all of us to obtain optimal health without toxins. Being creative is an opportunity we have right now in a way we didn't. Most of us were so busy during this pre-pandemic state we were in that we didn't have an opportunity to really see how we wanted to fill our days between going to work and coming home. We were in a routine. Then the treadmill stopped in March and everyone's life has become super different. And as Jennifer mentioned, the stress in the healthcare system is just gone so far up. So we need to counteract that. My daughter gave me the advice a few months ago, Mom, get a hobby. And it sounded, sort of silly. But then I realized, yep, I'm a workaholic and things are changing and I need to do something that makes me laugh, lighten up, get away from it. So get a hobby, I think, was extremely good advice. I've watched some of my friends when my co-author from the Beauty Prescription, is actually doing Zoom cello lessons, which I think is extraordinary. She's a dermatologist, and my sister, who's an anesthesiologist, along with her husband, who's a head and neck surgeon, have taken up birding. And so they're out, away from everybody, taking photos of birds, and they're really having a fabulous time. We have a picture here of painting, because that's something that you could do inside that's safe. So the most important thing with your hobby is make sure that you're not getting exposed to COVID. We all have to take a risk to go to work and we get exposed to COVID. So when we find a hobby, make sure that it's something we're not getting exposed to COVID. This is a great chance to rewire your brain. We know that our brains are neuroplastic, but we also know they're lazy. And so they are inherently trying to save energy. And the way they save energy is by doing what they used to do. So right now we can't do what we used to do. So we want to tip into that neuroplasticity and create new habits and hobbies. As I mentioned, I'm trying to cook. It's been a weakness for a long time, but I'm doing my best to lean into that. And also we're connecting with new people in different ways, and that can open our mind to new things. And I appreciate giving a lecture on Zoom. This is one of the first times I've done that. So it's creating some neuroplasticity in my brain. So thank you everybody for your attention today. Next slide. And then mindfulness. Mindfulness is, again, an ancient practice that, thank goodness, has become more popular lately. And we know as healthcare providers that mindfulness goes a long way to reducing a lot of the suffering that we're experiencing in our high-tech, high-busy world. So if you haven't leaned into mindfulness for yourself, this is the ultimate moment to create your practice. Mindfulness means coming into the present moment, being aware of what's going on, and touching into your own emotions. Doctors, nurses, healthcare providers were oftentimes trained to put our emotions to the side. They're not important. Pay attention to the patient. It's their emotions that are important. And yes, when we're in the hospital, that's true. But when we come home, we have to tap into our own emotions and our own emotional state. And I think it's very important during a pandemic to recognize that we're having a lot of negative emotions, and that's okay. It's appropriate. I don't think any of us went to medical school or nursing school or graduate school expecting to be treating in a pandemic, yet here we find ourselves. So it's okay to have negative emotions. Much better to express them than to try to deny or minimize them with alcohol or a pill. Helping others, seeing the importance of this moment is so important, because it gives us that sense of passion and purpose. And we know that that protects people against mental illness. Being grateful is something that's also an important practice of mindfulness. So yes, our days are very difficult, but early on, a family member got very, very sick with COVID. And a couple weeks later, she sent me a text that said, this went wrong, this went wrong, this went wrong, but I didn't have COVID today. And that text is stuck in my mind. So when I go and I have these trying days, then I think of that text and I say, well, I didn't have COVID today. So there's always something to be grateful for, no matter how tough the circumstances are. And again, mindfulness is the active practice of cultivating a different way of thinking. So thinking about gratitude, and then also thinking about something bigger than yourself can take you away from your individual suffering. So we know that as a society, we have gotten away from the practice of formal religion. Now might be a time to come back to some sort of bigger meaning. Why are we here? What is your purpose? What are we learning from this COVID crisis? How can we emerge from this better? Next slide. Early on, I wrote about the growth during the COVID crisis, and you can have access to the article. I sort of laugh at myself when I look back, because I thought this was going to be 2 weeks, then I thought it was going to be 3 months, then I thought it was going to be 6 months. Now I think it's going to be forever. So it's really uncharted territory, and therefore it's very hard to think about the future. Again, another reason to come into the present moment. But as we think about this COVID crisis, it has definitely created a lot of opportunities for growth. And you know that phrase, what doesn't break you makes you stronger. So this is this COVID crisis. And unfortunately, we have lost a lot of people and they won't be able to grow from this. But those of us who are remaining have definitely reprioritized. We are not out there running, going, doing all the things that we used to do. We have definitely learned new skills of self-care at work and at home because we can't rely on so many other people. We've absolutely given Mother Nature a break. We're not on planes, trains, buses, and cars. We've learned to cope with sustained fear. This is going on and on. We can't be in hyper arousal for a year and a half. We've got to learn how to get away from the fear and create some bliss for ourselves. Many of us have had to practice dealing with loss. It's been a time where not only have we lost to COVID, but we've lost to the chronic stress, so many people. And yet we've had to go on. So we practice resilience. We practice being self-sufficient. And the last thing I'd like to say is I hope that we're starting to restore some of the prestige and integrity of our profession. This was a profession that we went into with noble reasons, noble expectations. We've been downtrodden with the amount of regulation, the amount of charting, etc. This is a moment, I think, historically to show how much we value being healthcare providers, how much we value our scientists, and how without us, it's almost unfathomable to think what this COVID crisis would be like. So I know for me, I've always been proud to be a physician. I'm third generation physician. I hope everybody can also feel extremely proud of what they've done on an everyday basis now for many, many months, and to keep going forward with that sense of purpose and pride. Value yourself, take care of yourself, and then we can continue together to take care of others. And last slide, I hope we can embrace the learning and growth in the midst of this ongoing trauma. We must remember to work together to stop the spread, to care for our sick, and to rebuild our nation as we emerge from this COVID crisis, hopefully stronger. These are the links to the articles written in March. As I said at the beginning of the talk, I didn't tell you anything you don't know, but I can guarantee you that there's not a single person listening who's doing all of this. So we all have room for growth. So please try to take something home, whether it's improving your sleep, eating better, meditating, breathing, whatever it is. But let's all try to do our best to take care of ourselves. I love the slide that Jennifer sent. And are we going to be mindful with all this clutter, or are we going to tap into nature, gratitude, and try to feel better as we continue to move through this crisis? Thank you, everyone.
Thank you, Dr. Ritvo. And as you've been talking, I've been practicing my 5.5 seconds in and 5.5 seconds out. My little cat jumped on my lap, so I've been petting my cat. So I feel like even when we're working from home, we can really use some of the tools that you talked about. And I really feel grateful that I got to share time with you and that we got to share time with all the folks listening out there. And hopefully they can take some of these steps to heart and just take by each second, each moment, and each day, and try to improve the quality of our lives, which will help us care for those that we love and our patients. And it was great to work with you today.
Thank you, Jennifer. It's been a pleasure.